Hi there. Have you ever felt like your stomach's plotting against you after a slice of bread? Or maybe pasta leaves you more bloated than satisfied? Today we are diving into the world of celiac disease. What it is, why it happens, and how to find out if you have it. So what exactly is celiac disease? It's not just a trendy diet or a mild sensitivity. Celiac disease is an autoimmune disorder. When someone with celiac eats gluten, which is a protein found in wheat, barley and rye, in Indian parlance it is called atta, maida or rava, their immune system mistakenly attacks the lining of the small intestine. This damage hinders nutrient absorption, leading to a host of health issues. Celiac disease is caused by your immune system's abnormal response to gluten, which is a usually harmless protein. Wait, I think I made it very complicated for you. So let's understand why this happens in very simple terms. Celiac disease is caused when your immune system suspects that gluten is harmful to your body and produces antibodies to fight against it. This causes inflammation in your gut, which damages your villi and leads to the symptoms of celiac disease. Now, what are villi? Imagine your small intestine as a plush carpet with tiny fibers that absorb nutrients. In celiac disease, gluten acts like a villain, flattening those fibers and turning your nutrient absorbing carpet into a threadbare rug. Let's simplify it. So villi are tiny hair-like projections and tissues lining your small intestines inside walls. They play a very important role in digestion, absorbing nutrients from food and helping to deliver these nutrients to the blood. Any damage to these structures may cause malabsorption, making it difficult for your body to get the energy it needs. Now you can imagine. You eat gluten, your body's immune system identifies it as a threat and immediately produces antibodies to fight against it, causing inflammation in your gut, which damages villi. In other words, the gluten triggers an attack by your immune system on your intestinal villi. Following a nutritious diet, staying hydrated, and regularly exercising can keep your villi healthy. If you want to know more about villi, I'll drop the link in the description. Now coming to symptoms of celiac disease. It can differ widely and might not always involve the gut. Common signs include digestive issues like diarrhea, bloating, gas, and constipation, fatigue and irritability, skin rashes like dermatitis hypertiformis, iron deficiency, which is also known as anemia, joint pain, and headaches. In children, it is usually depicted as delayed growth and puberty. Surprisingly, some people have no noticeable symptoms but still suffer internal damage. It's like having a silent saboteur in your system. According to Mayo Clinic, children with celiac disease are more likely than adults to have digestive problems, including nausea and vomiting, chronic diarrhea, swollen belly, constipation, and gas. Celiac disease is influenced by genetics and environmental factors. If you have a first-degree relative with celiac, your risk increases. Certain genes, specifically HLA-DQ2 and HLA-DQ8, are commonly associated with celiac disease. However, not everyone with these genes develops the condition. Factors like early gluten introduction in infants, gastrointestinal infections, and gut microbiome imbalances may also play roles. One can get celiac disease at any age, but it's most likely to be diagnosed in children between the ages of 8 months and 1 year when they first start eating foods with gluten, and in adults in midlife between ages 40 and 60. Some people have celiac disease for years before they get the right diagnosis. Now, why is early diagnosis of celiac disease important? Because continued chronic inflammation from untreated celiac disease could result in other food intolerances such as lactose intolerance. It could lead to sores and scarring in your intestine, which can lead to narrowing and blockages. A compromised immune system, which makes you more vulnerable to other illnesses including other autoimmune disorder. It could also lead to liver disease, which may develop due to abnormally high levels of liver enzymes. Several types of liver disease have been linked to celiac diseases. Diagnosing celiac disease involves several steps. First, serology tests. Blood tests check for specific antibodies that indicate an immune response to gluten. Second, genetic testing. It identifies the presence of HLA-DQ2 or HLA-DQ8 genes. Third, endoscopy with biopsy. A small tissue sample from the small intestine confirms damage to the villi. Important tip: don't start a gluten-free diet before testing. Removing gluten can lead to false negative results, making diagnosis tricky. Currently, only effective treatment for celiac disease is a strict, lifelong gluten-free diet. This means avoiding all foods containing wheat, barley, rye, or maida, atta, and rava. Maintaining healthy villi involves a balanced diet rich in vitamins and fiber, staying hydrated, and incorporating probiotics into your diet. While it might seem daunting, many natural gluten-free foods do exist, and the market for gluten-free products has expanded significantly. Working with a dietitian can help ensure nutritional needs are met and prevent deficiencies. Celiac disease is more than just a dietary preference. It's a serious health condition requiring careful management. If you suspect you have celiac disease, consult a healthcare professional for proper testing. Remember, knowledge is power. Understanding celiac disease is the first step towards managing it effectively. For more information and support, you can check out our resources like the Celiac Disease Foundation and Mayo Clinic's Celiac Disease Overview, Celiac Society of India. There are many out there. Living with celiac disease requires vigilance, reading labels, communicating dietary needs, and planning ahead. Support groups and resources can make the journey easier. Celiac disease is manageable with the right knowledge and support. Subscribe for more insights and tips on living gluten-free. Don't forget to hit that notification bell for more health insights. In our next video titled Gluten-Free 101, a beginner's guide, I will help you understand what gluten is, foods to avoid, and safe alternatives. I'll also share some tips for reading labels and avoiding cross-contamination. Until then, stay